824, welcome back everyone. The University of Illinois Health System is working to help patients with type 1 diabetes through a new treatment approved by the FDA last year. Now, here to tell us more about the life-saving treatment is Dr. Lorenzo Gallone, Medical Director of UI Health's Abdominal Organ Transplant Program and Director of Transplant Research. Thank you so much for being here.
Thank you, Anita.
We know you have a wealth of knowledge here, so let's just start with what this treatment is, Lantidra.
Yeah, absolutely. So Lantidra basically is the isolation of islet cell from the pancreas, and these islet cells are then infused with minimum invasive procedure into the portal vein of the liver, where they sit and they produce insulin. Just to give you a perspective of the problem, there's about 2 million people in U.S. with type 1 diabetes, and a percentage of them, 25%, suffer from this is called hypoglycemic unawareness, which basically they don't feel the glucose in their bloodstream to drop, and as a consequence, they suffer all of the complications. Hypoglycemic unawareness is associated with death, seizure, loss of consciousness, cardiovascular disease. For this patient, really have a very complicated, miserable life, and unfortunately, fortunately, we have the possibility to now treat them appropriately with this product.
Yeah, and there's a wide range when it comes to the complications, as you said, from diabetes. Who's your ideal candidate for this?
So these are basically patients that, again, suffer from hypoglycemic unawareness. They have children. There's about 300,000 children and adolescents in the U.S. that have type 1 diabetes. A lot of them suffer from hypoglycemic unawareness, but also young adults that suffer from type 1 diabetes for many years. And the therapy allows them to really become insulin-free. In fact, 2 of the major studies, UI Health 001 and 002, that were done in 2004 and 2007, respectively, show that about 70% of these patients become insulin independent, so mean they no longer need insulin. But more importantly, or as important, 90% of these patients no longer suffer from hypoglycemic unawareness and no longer have an hemoglobin A1C that is in target less than 6.5. So this is really a true cure for these patients that before didn't have this opportunity.
That really is amazing stuff, and I don't want to be like an infomercial where we have to rush through any side effects at the end. So while we still have time, have you seen any side effects that could be a possibility for people?
No major side effect. Again, this procedure is minimally invasive, is rapidly done in interventional radiology suite. They may suffer from nausea, some abdominal pain, but beside this, really the side effect of the procedure is minimal. They might have long-term side effect of anti-rejection medication. As you know, this is a product that is produced by allogenic islet cells. So in other words, we have to use pancreas from individual and patient that die, and the long-term effect is the typical effect of long-term immunosuppressed therapy that is also associated with any organ transplant that we perform. But the risk and benefit obviously is much more toward the benefit of the patients, which no longer have, this severe episode of hypoglycemia, which is, like I said to you before, is associated with multiple complications, including death.
Yeah, it's only available at UI Health now, as I understand it. Are there plans to expand to other healthcare systems?
At the moment, the therapy is available only at UI Health. I'm sure that because of so many patients around the country suffer from this disease, this will be available to many other transplant centers. But at the moment, it's going to be available only with us for this profound collaboration between UI Health System and CellTrans, which is a company that produced this product in collaboration with UI Health.
Okay, and just on a final note, what's the feedback that you've gotten so far?
Well, I have many patients. As soon as we did the press release, we have many email, phone call from patients around the country that they want to be evaluated for this procedure. And now we open the door to them so we can offer them a true therapy and a true life-saving procedure.
Dr. Gallone, we appreciate you. Thank you so much for making time for us this morning. And thanks for what you're doing to transform people's lives.
Thank you. Thank you so much, Anita. Nice talking to you.
Great talking to you as well.